Often what we'll do in our live presentations, when we're up on stage at various seminars and meetings, is that we will ask the audience if they can wrap their heads around this one concept, and we're going to talk a little bit about it here. Did you know that the dental market, the dental consumer market, is split in half? There's two parts to it.
Yeah,
right?
and actually the question is, usually comes from the audience, sometimes comes over the telephone coming into the office, but the doctors will initially say, I'm having a really hard time getting patients who care more about their mouth than a deductible, or patients who will accept my treatment, or patients, that will care about their mouth, basically, okay?
They're not a good enough quality patient. What am I doing wrong?
Right, so that's the question, and that's where the question comes from, but the answer is, as Howie said, take all the moms in the U.S. Mom is the dental market, basically.
89% of dental appointments are made by women, okay? They're the healthcare decision makers.
Make no mistake.
We all know that.
Right, okay, so you take all the moms. Here's the half. Half of the moms will make a choice for a healthcare provider based primarily on price.
Primarily on price.
That's key.
The chief concern.
Right. Half the moms in the country would never choose a healthcare provider based primarily on price. Look around you. How are most dentists promoting their practices? And you're going to see the preponderance and primary is price. So they are scooping off that segment of their local market. It makes them feel good temporarily because those are volume responders. Seriously, you could take bar napkins and put free exam and x-rays and drop them out of a helicopter into a neighborhood with your phone number on it and your phone would ring. There's nobody here is doubting the bottom of the half of the dental market exists. Dentists don't realize that the top half exists. Now, if you don't believe us, get in a social setting with 5 females, ages 30 plus, and ask them the following question. Would you choose a healthcare provider for your family based primarily on price? And more than half will look at you like you have 3 eyes in your head, or you have 1 eyebrow,
Are you nuts?
Or both, okay? What you're dealing with here is not theory. You're not dealing with an idea, okay? You're dealing with genetics, okay? It's the genetic protective instinct of the female. And some females have this much, and some females have this much. Just like Howie has a full head of hair, and some of mine is going away, okay? It's genetics, all right? It's the same. That identifies the bottom and the top. If you promote to the bottom primarily, you are actually alienating the top, okay? Those moms will make a decision not to choose you instantly.
Right.
And there's almost nothing you can do to change their mind if you're promoting too much about price.
Right.
Okay?
It's not the price is of no concern or 100% concern. It's somewhere in the middle.
It's still a concern.
Yeah, it's a concern.
Right. I mean, even in the top half, the mom wants to make sure that you're affordable.
Right.
But you don't put a starburst with free exam and x-rays and have that the primary driving element, the primary element of your advertising piece to create a result.
Right.
When virtually everything that you do is a mystery to the dental consumer.
Right.
All the way back to what we said in the other video, like intraoral cameras are 25 years old. Well, the consumer doesn't know that.
Yeah.
Only you know that. It's only boring to you.
Yeah.
It's not boring to them. Digital x-rays, 6-month smiles, sleep apnea. Diagnodent. You people do so many things for your patients, and you get yourself stuck in believing that all dental consumers know all this stuff.
And that they're only concerned with price.
Only half of them are. And that they're only concerned with price. Right. We would say, back to the person who asked us that question in our audience or over the telephone, doctor, look at your promotion. And 99% of the time, the doctors come back to us and say, yeah, well, I have an ad in Valpak. Well, what's Valpak? Valpak is an envelope of what? Coupons.
Yeah.
Mom would not pull out a coupon out of a Valpak in the top half of the market. She won't even look at it.
Yeah.
Okay, she's like, and she'll just throw it away. So, moving forward with your promotion, you needed to decide which half of your local market you want to go after.
Now, they're both viable.
Very viable markets.
Promoting on price is perfectly fine. There's a couple of problems that you may have, though. In fact, the father of modern advertising, one of my heroes, David Ogilvy, said, any damn fool can promote on price.
Right.
You just put the lowest price out there and you're going to get business. But is that the quality of patient that you want in your practice? That's the question. Now, if it is, and you're a high volume practice, fine. You're going to be competing with the corporate chains who have a far bigger budget than you do.
Right.
And if you're going to engage in a price war, recognize that you've probably already lost that war. Okay?
Right.
But it's not an illogical or crazy market to go after. It's perfectly fine. Somebody's got to service those people.
Right.
But if you want a higher quality patient in your practice, you need to promote to the top half of the market. That's our point in this segment.
Right. The top half, you don't need NPI's 25 years. You don't need our consumer research. You don't need our testing. You don't need any of that stuff to go after the bottom half of the market.
Right.
You could hire a graphic designer on Craigslist for $15 to make you a postcard design with all kinds of offers on it and get them out on the street. You don't need us.
Right.
Okay? The top half of the market, that's the half that requires all that finesse.
Yeah.
Okay? All that time, all that experience, all that testing, all that research. The top half will almost always return 9 times the revenue benefit than the bottom.
Yeah,
Okay?
9 times.
9 times, okay? And this is over a period of 6 years, all right? So as the dentist, as the owner, as the CEO of your business, you needed to determine what mix you want. Do you really need that much volume? Or do you really only need, a handful, 8, 10, 20 really good solid new patients a month to help regrow or continue the growth of your practice,
Right.
okay? If you only need, 5, 8, 10, 20, you probably shouldn't even be in the bottom.
No.
Some practices that we have, clients of ours, need both.
They do.
If you go after both, though, at the same time, simultaneously, you have got to do it very carefully, because if there's too much price promotion, you're going to alienate the top, and you won't get the revenue benefit.
Right.
So they have to be very well coordinated and very well orchestrated from a management standpoint.
Actually, you should treat the two halves as totally separate audiences
Exactly.
with different promotional messages
Right.
to each one.
Right.
That way you won't confuse the two.
Right.
One of the big mistakes that we see is, going after the top half of the market. They put out a promotional piece that gives all the great benefits of their practice in a modern dentistry. And then on the other side of it, there's free this, free that. And so it confuses the moms in the top half of the market. Where are you?
Actually, it confuses both.
Yeah.
In that case, it confuses both, because
Yeah.
you'll see cosmetic dentistry, you'll see something about veneers, you'll see something about braces, and then you flip it over and you see $79, $39, $49.
Yeah. Or a dollar.
Or a dollar, and the moms in the top are going, okay, they like the service end, they like the convenience end, they like the technology, and they turn it over and they go, wingo.
Yeah.
The moms in the bottom aren't totally disinterested on the cosmetics and the 6-month smiles and all the other stuff, and all that stuff, and they turn it over. You're going to get more off the bottom, but you're going to alienate the top. And so if you're in a position where you need to go after both simultaneously, large practices,
Just starting out.
huge open capacity, startups, where you might, for a period of time, have to go after both segments of the market, you got to do it the right way so as not to alienate either half.
Exactly.
Right.